Now, hierarchical conditional code categories aren't a new concept, but as more and more organizations shift towards value-based care, there has indeed been renewed interest in the model. And it makes sense. Without solid foundational knowledge of HCCs, health systems risk lower rates of reimbursement, reduced care continuity and quality of care, and increased burden of the management of longitudinal health outcomes. Hierarchical conditional codes is one of the many risk adjustment methodologies that significantly contributes to the manner in which payers stratify risk, reimburse providers, and provide care to what is approaching nearly 55% of America, and that number steadily compounding. Here's what we know about HCCs and its impact. Data shows that using just CMS HCCs capture at least 90% of the risk adjustment for inpatient and outpatient programs. When we think about applying Occam's razor to the challenges that we face with risk stratification and care quality, HCC capture and recapture for management of chronic conditions and comorbidities is a well-grounded strategic lever. So we know that HCC documentation is critical for base rate determinations as well as medical premiums. None of this is lost on our audience here, but a greater degree of specificity by way of categorically identifying and documenting those HCCs translate to improved RAF and increased reimbursement. IMO powers EHRs with proprietary mappings from various code sets, as well as specified coding from ICD-10 to categoric HCCs. Here at IMO, we've seen an effective payer strategy fosters correct coding under risk adjustment models, which are necessary to properly identify risk and enhance collective savings.